Well, those patients are more aware, perhaps more interested, more understanding, and they're trying to make sure that they are taking very good care of themselves. Which brings me to my next question about family history. What's the relationship between a family member who develops, let's say, melanoma, and other family members? Is there a relationship there?
There is in a couple different ways. Certainly family history and genetics play a role. In melanoma it plays a role in that people with, who I call, if they're moly, if they have hundreds of moles, an individual with over 100 moles has a higher risk of a malignancy or a pre-malignancy than someone with one mole. And that's, a lot of times, the number of moles you have is determined by heredity. So that plays a role. But if you have a family history of someone with melanoma or one of the non-melanoma skin cancers, it's tough to put a specific number on what your risk is.
Right.
I tell folks that it's more likely than someone without a family history, but to put a certain number on it is difficult. Now, what we do know with non-melanoma skin cancers, particularly basal cell, if you've had a previous history of a basal cell, you have a 50% chance for developing another one over the next 5 years. Heredity-wise, with basal cell and squamous cell, if you have skin that is fair skin, maybe mainly a skin of European descent, Irish, English, German skin, that certainly is more prone to that UV or ultraviolet induced sun damage. It has more of a tendency to burn, and therefore that sun damage and the burn has more of a chance of causing a skin cancer down the road. Are darker skinned folks immune? No. But fair skinned folks certainly make up the majority of people with skin cancer problems.
So fair-skinned people especially need to protect themselves with sunscreens and products of that nature, and they can enjoy the outdoors and they can enjoy the sun without becoming victims of the sun, correct?
Absolutely. I tell my patients all the time, I don't want my patients to become hermits. We live in a beautiful place with plenty of things to do outdoors, and so the approach is to try and do things with moderation. And what that means is enjoy all the things you do outdoors. Try and do them maybe before 10 or 11 a.m. and after 4 or 5 p.m. Try and avoid those hours between 11 and 3 p.m. when the sun is its strongest. Sunscreen is essential, and it's confusing because there's so many different sunscreens available, so many different SPF numbers. So what I tell patients is you want to have a SPF of 30 or above. You want to try and have the ingredient zinc oxide or titanium dioxide. That's zinc oxide or titanium dioxide as an ingredient in the sunblock. And the reason is those are inert chemicals that do not break down in the sun as readily as chemical-based sunblocks, and they tend to stick around longer. With sunblocks, you also want to reapply after 2 hours because sunblocks do perspire off and break down. If you're in the water, you want to reapply sooner. That's right. If you hop in the pool and you had just put your sunblock on, you really should apply, and you want to apply it liberally. The proper amount would be about, to cover the whole body, is almost a shot glass of sunblock. Okay, that's a lot of sunblock. Some people use it very sparingly. You want to use a good amount on the exposed areas. And just remember also proper garments. A good wide-brimmed hat, even though they take a little getting used to, I tell you, are one of the best things you can have. Polarized sunglasses are fabulous. And then these new materials that we're using and finding that wick away sweat, but are also impregnated with a sunblock material in them, and they're very comfortable to wear. You can find them at most fishing stores, and those provide excellent protection.
Well, I know some of the numbers may not be understood by folks, but you mentioned before we started rolling here, that women in the age bracket of, let's say, 25 to 29, melanoma is like the highest form of cancer that affects them, above all others.
Yeah, it's pretty alarming. We're seeing increases across the board in all age groups, but the biggest increase age group are women, females, age 25 to 35. And the statistics show that right now, women age 25 to 30, that age group, are the number one cancer being found in that age group of women is melanoma. If you go up 5 years from age 30 to 35, it's the second most common type of cancer, only behind breast cancer. And we're not sure exactly why this is, but we do know that this trend does seem to be continuing. And it may be the effect of external factors like sun tanning beds, which many women that age do frequent.
Tanning beds.
The tanning beds. And the American Academy of Dermatology, as well as the World Health Organization, has deemed tanning beds as a carcinogen. And I tell my patients that they should avoid that practice. And if they want color, they can get it from a bottle. There are numerous different sunless lotions that can tan the skin beautifully and safely.